Thank you, Mr. Speaker. Mr. Speaker, House Bill 126, previously sponsored by former Chairman of the Health Committee, Representative Matt Baker, was unanimously passed by the House last March. The bill creates the Epinephrine Auto-injector Entity Act to allow authorized entities in Pennsylvania to maintain a supply of Epi-pens and outlines requirements on use and training of these Epi-pens. The Senate amended the bill to add a new chapter to Title 35 entitled the Cancer Clinical Trial Access for Pennsylvania patients. The purpose of this chapter is to allow more access to clinical trials for patients who would not participate in the study due to limited financial means. The bill passed the Senate unanimously. House Bill 126 was also amended in the House Rules Committee to add law enforcement agencies to the list of individuals who can maintain a supply of epinephrine auto-injectors. The bill is also amended to expand upon the exceptions in Title 35 relating to prescribing opioids to minors. Mr. Speaker, every 3 minutes in the United States, a food allergy reaction sends someone to the emergency room. The Centers for Disease Control and Prevention reports that prevalence of food allergy in children has increased by 50% between 1997 and 2011. Researchers also estimate that up to 15 million Americans currently have food allergies, including 5.9 million children under the age of 18. That's 1 in 13 children, or roughly 2 in every classroom. Mr. Speaker, many of my colleagues here today are aware that my 4-year-old son, Ben, recently had a life-threatening anaphylactic reaction from an unknown allergy to cashews. That July afternoon, alongside a Perry Office police officer, my wife Leslie and I waited the longest 25 minutes of our lives for an ambulance to arrive at our home. Thankfully, after medical attention and a night in the hospital, Ben's reaction subdued. However, Mr. Speaker, holding your child in your arms and not knowing if they're going to live or die is one of the hardest things I've ever experienced in my life. And not a day goes by that I do not thank God that our loving little boy is still here with us today. We now carry an EpiPen with us at all times. But Ben is not the last child that this is going to happen to. And because of that, Mr. Speaker, I ask that my colleagues here today support House Bill 126 so that we may potentially save the life of the next child experiencing an anaphylactic shock. Thank you, Mr. Speaker.